Causes, signs, symptoms and treatment of gestational diabetes. What causes gestational diabetes? Insulin is a hormone created in the pancreas that directs the body's digestion of fats and carbs and enables the body to transform sugar into energy. Gestational diabetes is when hormones from the placenta block insulin, keeping the body from regulating the increased blood glucose of pregnancy successfully. This causes hyperglycemia, or elevated levels of sugar in the blood, which can harm the nerves, veins and organs in your body. If you are watching this video for the first time, please kindly like this video, hit the subscribe button and click on the bell icon so that any time I make a video like this, you will be notified. When does gestational diabetes generally start? Gestational diabetes as a rule begins between week 24 and week 28 of pregnancy. Who's most in danger for gestational diabetes? While scientists aren't sure why a few ladies get gestational diabetes while others don't, they do realize that you might be at a high risk if you are overweight. Having a BMI of at least 30 going into pregnancy is one of the most well-known hazard factors for gestational diabetes, in light of the fact that the additional weight influences insulin's capacity to hold glucose levels within proper limits. You have a more elevated level of stomach fat. Exploration distributed in the American Diabetes Association's diary Diabetes Care found that ladies who had more elevated levels of belly fat in the primary trimester of pregnancy might be bound to be determined to have gestational diabetes later. You are older. Specialists have noticed that ladies beyond 35 years old and altogether higher danger of developing GDM. You have a family history. On the off chance that diabetes runs in the family, you might be more in danger of GDM. Ladies who are African American, Hispanic, Asian or Native American are likewise factually bound to get a GDM conclusion. You got a pre-diabetes analysis. On the off chance that your glucose levels are marginally raised before pregnancy, you might be at higher danger of GDM. You have been put on bed rest. Some examination has demonstrated that since you're idle on bed rest, you're bound to put on more pregnancy weight and, along these lines, bound to create GDM. What are the side effects of gestational diabetes? Most ladies with gestational diabetes have no indications, however a couple may experience irregular thirst, frequent urination in large amounts distinguished from the additionally frequent yet normal light pee of early pregnancy, exhaustion, which might be hard to separate from typical pregnancy weariness, sugar in the pee, recognized at a standard specialist visit. How is gestational diabetes analyzed? You've presumably seen at this point your PCP requests a pee test at each office visit. That is to a limited extent to check for sugar in your pee, which can be an indication of gestational diabetes. However, one positive screening doesn't really mean you have gestational diabetes. How does gestational diabetes influence me and my infant? With legitimate treatment and normal checking by your professional, gestational diabetes can be overseen and isn't harmful to you or your infant. Yet, on the off chance that GDM isn't dealt with, and over-the-top sugar flows in a mother's blood and the baby's, the likely issues for both mother and infant are serious. Ladies who have uncontrolled GDM are in danger of having a too huge child, a condition called macrosomia, making conveyance more troublesome and C-area almost certain. They are likewise in danger for toxemia and stillbirth. What's more, on the grounds that gestational diabetes is viewed as a pregnancy entanglement, pregnant ladies who have it might be bound to be prompted, since most specialists won't let their pregnancies progress past their due dates. Uncontrolled diabetes could likewise prompt expected issues for the child after birth, for example, jaundice, breathing troubles or ND low glucose levels. Further down the road, the person in question might be at an expanded hazard for obesity and type 2 diabetes. In any case, remember, these potential negative impacts don't have any significant bearing to mothers who follow their PCP's suggestions to monitor their glucose. What you can do to prevent gestational diabetes. On the off chance that your solitary hazard factors for gestational diabetes are a family ancestry of the sickness or potentially progressed maternal age, there might be nothing more you can do to forestall your odds of building up the condition. Be that as it may, in case you're overweight, don't eat an even eating regimen or don't routinely work out, embracing a few healthy habits can have a major effect. What's more, with enough reiteration, they'll in the end require less cognizant exertion to keep up. The accompanying advances can largely affect diminishing your danger of creating both gestational diabetes and type 2 diabetes, both before you consider and during your pregnancy. Remain dynamic. With the inspiration of your infant in transit, now is a phenomenal chance to begin a wellness schedule. Working out under your professional's direction, even a 15-minute stroll after lunch and supper, permits your body to consume glucose even without the insulin your body ought to ordinarily deliver. It's an incredible method to hold your blood sugars under tight restraints. In addition, you'll likely love the manner in which you feel once you start consistently working out. Eat a solid eating regimen. Making changes to your eating routine now not just ensures you and your child during pregnancy, it likewise encourages you to grow better dietary patterns forever. Devour an even eating regimen stacked with an assortment of products of the soil, lean, solid protein, and complex carbs. Intend to restrict your fat, particularly immersed and trans fats, nourishments like margarine, palm and coconut oils, cheddar and prepared meats, and attempt to maintain a strategic distance from sweet, handled food sources. Think high-fiber, low-fat alternatives, entire grains, low-fat dairy, lean red meat, poultry, vegetables and fish, and watch your segments. Watch out for the scale. With the assistance of your professional, attempt to keep up a typical weight and BMI, that implies meaning to put on the perfect measure of weight during pregnancy and lose the additional pounds after. How is gestational diabetes treated? Luckily, you can take out for all intents and purposes the entirety of the potential dangers related with diabetes in pregnancy via cautiously controlling your glucose levels. In case you're determined to have GDM, specialists and scientists suggest the following. Screen your glucose level a few times each day. Check before anything else to get your fasting rate and afterward an hour after you eat every feast to ensure your glucose remains in a solid range recommended by your primary care physician. Most specialists recommend that you purchase a diabetes unit, which incorporates needles to prick your finger and a little machine that peruses your glucose. Try not to stress, the finger prick doesn't do any harm, and it's the most exact approach to tell how your body is preparing different nourishments. It's enabling when you settle on solid food decisions and your glucose perusing is acceptable. You're playing a functioning job in your own well-being, and, obviously, your baby's. Meet with a dietitian. She can assist you with looking into solid food alternatives and make a dinner arrangement. Numerous ladies adhere to their gestational diabetes diet of even dinners long after birth. Keep a food log. After every feast, record all that you ate alongside your blood glucose number. This encourages you to all the more likely comprehend what nourishments are spiking your glucose levels so you can stay away from them. Get going. Take a walk or use the stairwell after a supper to bring down your glucose levels. Get going. Take a walk or use the stairwell after a supper to bring down your glucose levels. Diet and exercise are frequently enough to control gestational diabetes, yet on the off chance that they don't, your primary care physician may propose that you take advantageous insulin to control it. It tends to be offered in chances, however the oral medication glyburide, a diabetes prescription that enables the pancreas to deliver insulin, is being recommended increasingly more frequently for GDM. Your PCP may recommend extra fetal checking in your third trimester, including non-stress tests, to ensure your child's pulse and developments are ordinary. What to eat during pregnancy? Eating well during pregnancy. What befalls you after pregnancy? Exploration has indicated that ladies with gestational diabetes have a 3 to 7% possibility of creating type 2 diabetes in 5 to 10 years, which is the reason it's so critical to make those solid propensities routine during pregnancy and keep aware of your well-being significantly after your pregnancy is finished. Here are a couple of approaches to remain sound post-birth. Stay aware of specialist visits. Ensure your essential consideration doctor and additionally Ob-Gyn rethinks you after your baby blues visit, at about a month and a half and afterward again consistently, to check for proceeded with issues with glucose and HbA1c glycated hemoglobin levels. Converse with a nutritionist. She'll assist you with developing an eating routine you can keep up that will assist with controlling your glucose levels. Keep on eating as sound as conceivable consistently. Attempt to stay away from sugars and refined starches that spike your glucose and can add to the advancement of type 2 diabetes. Keep in mind, sugar and straightforward carbs are all over the place, so make a point to peruse names cautiously. A nutritionist can assist you with understanding key fixings to look out for. Rather, settle on natural nourishments like vegetables, low-fat meats, dairy and entire grains. Breastfeed for to the extent that this would be possible. Breastfeeding may diminish your danger of creating type 2 diabetes after gestational diabetes. There are a few potential clarifications, including that breastfeeding ladies have lower levels of glucose circulating in their blood. Fit in wellness. In spite of the fact that it's difficult to remain dynamic with a child who requires the entirety of your consideration, and that's just the beginning, attempt to fit in however much specialist-endorsed practice as could reasonably be expected to assist you with losing the pregnancy pounds and hold your weight in line. For more tips on living with type 2 diabetes, click on the link below this video. Thank you for watching.